Today we're going to be discussing the Harbour mental health facility in Blackpool, the United Kingdom. This is a mental health hospital where patients go for inpatient treatment. So as people may or may not know, we have a national health service in the United Kingdom. Most people, unless they decide to play private, will use the NHS, the National Health Service, for their treatment. And that means that we do not pay at the time of treatment, but we do pay through our taxes. In my opinion, the NHS is one of the greatest things about this country. Unfortunately, at the moment, it isn't in the best state in terms of funding, wait times, quality in some places, and unfortunately, in this particular discussion and incident that happened, we are going to see a time the system completely failed a person and their whole entire family. So in order to discuss this, I want to first tell you a little bit about what I found about the Harbour in Blackpool. So the Harbour has 154 beds, so that is the capacity to hold 154 patients. But on the 1st of February 2019, there was an article wrote in the BBC online that said the following: there are concerns that patients and staff would be at risk of frequent serious assaults. One of the staff members was quoted saying that someone could be seriously hurt. There were claims of violence, smuggling drugs, kicking off and throwing chairs from patients. The Lancashire Care NHS Foundation Trust did make a statement that it acknowledged the pressures, however it denied claims that it was unsafe. And this was on the 1st of February 2019. And the staff members who had made statements in the article claimed that the reason for these increased risks of harm and danger to patients and staff were due to a lack of staff, not having enough staff to give the adequate care to the patients that were there. Mrs. Smith, the Director of Adult Services, stated at the City Council meetings that the staff were working undoubtedly hard, but that things are absolutely beyond a level that is acceptable. There had been incidents with drug and glass bottles on the wards, and these are things that can cause major harm on a mental health ward. All of these things were being reported in 2019. This is before the incident that we are going to be discussing. These incidents that were being written about in the articles are clear signs that something needed to be done to help this facility. In the article, there was claims that there had been incidents with alcohol being snuck onto the premises and glass bottles that were being smashed and used as weapons or other things. In a mental health unit, the majority of people are there because they are the most vulnerable in our society. They are unable to cope alone with their mental health, and in the time that they are put into a hospital or they have asked to be put into a hospital for mental health, it is because they are unable to manage their mental illness by themselves. Their mental illness is trying its best to win over the person who is struggling, and they are fighting for their life. And to be able to have something like a glass bottle on a mental health ward not only puts the staff at risk, it puts other patients at risk. You could have people with schizophrenia, people who are having dissociative episodes, people who are hallucinating. They could injure someone without realising that they were doing it or thinking that they were doing something else, and they could, most importantly, harm themselves. Anybody that has been put on a section in a mental health facility should not have access to anything that can harm themselves. Even when you're given charges on a ward in a mental health facility, it's that long. You get a cable that is that long for obvious reasons. Things should be stuck down. You should not be able to pull anything. You should not be able to hang from things, because they should be designed to break so that there is no leverage, nothing to keep you there. These are all things that need to be happening. There should be safety. Staff should feel comfortable enough to be looking after a patient one-on-one, whilst all of the other patients are able to also be taken care of in the way that they need to be. Now, this is not the only report from this hospital. I searched this hospital and there are reports that go back to 2019, 2018, even 2020, There was constantly people demanding help. I found an article that stated that there had been 52 phone calls to the police from staff and from patients within a 6-week period. And if that is not telling people that there is an issue in this facility, I don't know what more could have been done, because clearly the right people were not listening. There's many reasons why there can be issues in a mental health facility. Unfortunately, when you are in a facility that is unsafe, there can be a high staff turnover, because if staff don't feel safe and they don't want to come to work and be at risk, they may leave the job or find somewhere else. Within the article about the 52 phone calls to the police within a 10-week period from the harbour, there was another distressing statement that claimed a nurse had been attacked by a patient who had thrown boiling hot water and sugar on her, and I can't imagine ever wanting to return to the workplace when something was able to happen to me like that. I know that they are high risk environments, but surely if this many incidents are happening, it is a red flag that we need to do something. We need to not have this place open while we investigate and we see what we can do to make sure that not only are our staff taken care of, but we are able to look after the patients in the way that they need and deserve. Now, I'm going to get on to talking about Brendan. This may be distressing to some people, so like I said, it's okay if you need to skip or leave. Bren was a young person who was struggling with his mental health quite severely, and he had been seen by a mental health professional who had stated that he needed 24/7 care because he was at risk of harming himself. For whatever reason, whether it was wait times or miscommunication, there was a delay in Brendan receiving this treatment. He was put on a section 135. Now, a section 135 means that the person needs to be taken to a place of safety so that he is unable to harm himself because he's at risk of harm or of losing his life to his mental illness. Unfortunately, this action was not carried out, so Brendan ended up not being sectioned straight away. He was waiting for a place in the harbour facility, and it sounded as if there was some kind of meeting or appointment where he claimed that he wanted to come into the facility. He obviously wanted to do everything he could to help himself, but it doesn't sound like the section 135 was executed correctly, because he should have gone, whenever this section was put on him, he should have instantly being taken to the mental health facility. Now, at mental health facilities, including the harbour, they have suites for people specifically designed for being on a section 135, and as we discussed before, they will be safe. They are meant to be a safe place for a person who is in extreme mental distress. So a patient should be searched on arrival. They should be made sure that they don't have anything unsafe, like shoelaces, any objects that they may be able to harm themselves with in any way. The rooms, like I said, they are purposely designed so that the person, if they are there alone, has nothing to harm themselves or to lose their life to the mental illness. They are also meant to be checked 24/7. They have somebody with them, and it might sound uncomfortable, but they would watch them when they go to the toilet, they would watch them when they get a shower. And I know that to most of us sounds horrendous, and privacy is so important, but when you are so unwell that if you are left alone, you are a risk to yourself, unfortunately, it is something that has to happen for the person's best interest. That is what should have happened, but when Brendan arrived at the harbour, he was not adequately searched because there was a confusion of whether he was in fact on a section 135. Regardless of whether there was confusion, I personally would rather be on the safe than sorry. So put him in the suite, make sure that you've done the adequate searches, and if you find out later that he doesn't need to be on a section 135, then you can loosen things up a bit. But I would not just not do the right steps. Again, I'm not completely blaming the staff at this facility. and I will discuss why I don't think they are solely to blame. However, when we see some video footage in a moment that I struggle to watch, you will realise why there is some personal blame in this. However, it's a systemic issue. So, Brendan was not adequately searched. He was placed in a 135 suite, and unfortunately, for whatever reason, Brendan didn't have 24-hour watch, and unfortunately, a tragic incident took place. Once Brendan was in the suite, he was only observed in a 59-minute period for 3 minutes. That means that a staff member who should have been with him 24/7 was only with him where she could see him or he could see him for a total of 3 minutes in a 59-minute period. And unfortunately, in those 59 minutes, Brendan lost his life to his mental illness. During that time, he had been left with items on him that he was able to create some kind of string or something of that sort, and he was able to use that to hang. And so many things led up to this issue, such as the item he was able to do this on should have been installed and designed to break so that he was unable to take this action, but that did not work. Another problem was that he shouldn't have been left with the items in the first place. He shouldn't have been left alone. While Brendan was losing his life to his mental illness, the staff who should have been watching him were in a staff room. One person was on their phone, 2 nurses were braiding each other's hair, another was sat spinning whilst using an e-cig for 59 minutes, whilst Brendan was alone in a place that he should have been safe and he should have been cared for. And there is no excuse for that. There is no excuse for that. And if you go into a job like mental health care, you need to understand the importance of that job. And I am not going to concentrate specifically on the individuals. I am not going to name them I will show the footage, or I may have already showed it, but I'm not going to concentrate too much on them because I want to discuss. I know it's a bigger picture and I understand that, and I'm not fully blaming those individuals. However, it pains me to see them sat there knowing what they should have been doing in a job that is designed and is meant to care for people, to prevent this happening, and a young life was lost unnecessarily if the correct steps had been followed. I have personally had people in a mental health profession that were meant to care and made things worse. I personally believe, and I think the jury believe, because yes, this did go to trial, and I think that the family, friends and parents of Bren definitely will believe that there were many, many mistakes made that led to this tragedy that should have been foreseen. Like I said, it didn't take long to find so many failings, so many cries for help from staff members and patients and family members of patients before this happened, but nobody took notice. And I do think there is a systemic issue within the mental health field, also within the NHS in general, but I just specifically want to concentrate with mental health. So I want to go through some of the failings and some of the things that I think can prevent things like this happening in the future, because unfortunately what's been done cannot be undone. However, we need to stop things like this happening in the future. In a facility for mental health, there needs to be enough staff, as we said before, but those staff need to have adequate training. The problem with having not enough staff in a facility or a high turnover means that you are going to need to take people on very quickly. And the issue with that is that they often then end up with not enough training. They may not be suited for the job. They may not have it explained to them exactly how difficult the job may be. Like I said before, mental health, if you go into that field, you need to have empathy, patience, understanding. You need to also have the training behind you and the tools to be able to do the job. That means having clean facilities. That means having the equipment that is needed. That means having the updated training and not just being trained and thrown straight in. Very full on training. Actually getting out there with somebody who can watch and assist you and make sure that you are fully competent before you are left alone with patients who you are responsible for. Because with mental health patients, they are vulnerable. They need people who can advocate for them. They need to know that when they enter a facility, the people there have their interests at heart. They are not concerned about going on their phone, using a vape, having a chat while you desperately need them, because they understand the magnitude of the job. They are qualified for the job. But this also means that there needs to be competitive pay. We need to have better pay. We need to have competitive pay to get the right people in the jobs, to get people who do want to do the job, do care about the patients, do have an understanding and are willing to go through the training. Because if there's not a competitive pay, we lose these people who could do amazing jobs to private sectors, to different countries, because at the end of the day, everyone needs a good standard of living. And for a job that is so dangerous and so consuming and takes so much out of and from a person, the person is not going to stick around if they are not getting the adequate benefits and pay. I understand that. So that needs to change. It means that we will get more people in the right jobs who are there for the right reasons, who are trained and ready and want to do the job. Training, again, is an issue. I also believe that we should not have facilities open if they are not running to the standard that they should be. If you are getting multiple reports, you will get an incident after incident in one facility. That facility needs to be closed and investigated. And I understand that people will say, well, there's no other room for anybody anywhere. Again, that's because of a lack of funding, a lack of facilities, and it's another thing that needs to improve. There needs to be places for patients, and also we need to have a better service for those people before they end up at the stage where they need inpatient care in the first place. If somebody needs inpatient care, they are at the point where their mental health is so severe, they are unable to look after themselves. They can't deal with it on their own. But if we had a better service, if we stopped closing down facilities and centres, we would have more appointments for people, we would have less wait times for therapies, we would have a better ability to help people before they reach this point. At the moment, the waiting times for therapy and for mental health is immensely long. We have people who are in crisis who cannot get help or support because the funding isn't there, and people will say that the NHS is a bottomless pit. Kind of, because it's not supposed to be there to make money. It is meant to be there to help not only the richest and well-off people in the country, but the most vulnerable. And it is one of the great things about this country. However, it's not being run correctly. There are people in the NHS who are high up, who are making excessive amounts of money, but it's definitely not the doctors, nurses, cleaners, porters, anybody else that is working in the NHS. They're not seeing it. The patients aren't seeing it. The facilities are definitely not seeing it. We pay through our taxes. We hope that our money is being used wisely, but there's a lot of people who would benefit greatly from the NHS failing. When we look at the American system, we know that doesn't work, but there are people that will look at that and know that it makes money. And of course, there's a lot of money to be made in sick people, unfortunately. However, we can see from a patient's point of view, from Americans themselves, that it doesn't work. It is terrifying. The thought of not being able to afford to live because you can't afford healthcare. Until we start to accept that the NHS does cost money, like we pay through our taxes, and it starts to be funded correctly, we start to prioritise patients over profits, this system is going to crumble, it's going to get worse. Unfortunately, what happened to Bren will happen again, and it will have happened before. There are patients and families being let down because they are relying on a system that is fundamentally not working anymore, but it can, and it has in the past. The NHS is something that I am so passionate about. The NHS has helped me more than I can say. Has there been bad experiences? 100%. At the moment, it's very difficult, and I know doctors, I know nurses. I was training to be a nurse quite a few years ago now, but it was not, I couldn't get over my fear of sick, unfortunately. I love the NHS, and I'm also not blind to the fact that there are people within the NHS who are making a lot of money, who are running the system very badly. That is true, but also so is the funding issue. So is the funding, so is the underpayment of staff, so is the lack of training or facilities or equipment or patient slots. People are leaving the NHS. People are not wanting to get into the NHS because it's not worth the money for the immense stress, which is leaving us in such a dangerous situation. The NHS has not just got to this point by accident, it has been slowly drained, and that is all I'm going to say on that, because I get very passionate and upset. But today, the incident that we're talking about is Bren. I didn't know Bren, obviously, but I feel very connected to his unfortunate story, his parents and his family. I just think too many people lose their life to mental health, and that's why I like to talk about it. That's why I like to draw attention to it. That's why I like to tell my stories, to help others feel less alone and to stop it being such a taboo topic. What happened here was wrong. What happened here was preventable. And I think it is something that we need to talk about. I wanted to draw attention to Brendan's story because he is somebody who had his life ahead of him and unfortunately lost his life to mental health. And thousands of people lose their life to mental health every day. Suicide is not a choice, it is a symptom, but that symptom is permanent. So that is everything I want to discuss today. I hope that this wasn't too distressing. I do have other videos that may not be as distressing as this one. I do talk about mental health and taboo topics, so please give this video a like, share, subscribe. Wherever that you are, I hope you have a lovely morning, day or night, and I will see you again next time. Bye.